Okay, today we're going to learn how to do a wet to dry dressing change. So our patient is the apple, and the apple has a wound that's opened, which happens sometimes with surgeries, and you get like a hole there. And we want you to pack it with a wet to dry dressing change, so I'll show you how to do that now. So you're going to want to find this loosely woven gauze. We can send you a link if you need a place to buy it. And you're going to open it like so. And what you'll do is you're going to wet part of it just in the sink. It doesn't need to be like any special water. You just wet it. And then you're actually going to wring it out because you don't want it sopping wet. So just regular wet. And then you'll come back over to the wound, or the wound's probably on you, so you don't have to come back over to it. And you're going to take all the wet part and get it all in the wound. Push it all the way down, around, everywhere. And then once it's all in there, take the dry part and you'll put that part on the skin, and you can either tape it or use your garment to just hold it in place. And then 3 or 4 hours later, you'll come and you'll take it out, and what will happen is the wet part will now be dry, and it might be kind of stuck to your skin. It might kind of hurt to pull it out, but that's okay. You might bleed a little bit. That's fine. It's all normal. It's pulling off all the bad dead tissue that we don't want, and it's going to start granulating in all the red beefy tissue that we do want. You can still shower as normal. Soap and water can get in that incision. That's all fine, but you're going to do this packing mechanism like 2 to 3 times a day, depending on like what we've told you. Usually you start at 3 times a day, and then you go down to 2 until basically the hole just will slowly close in on itself. And that's how you do a wet to dry dressing change.